Many people ignore the early signs of a stroke, brushing them off as stress, fatigue, or aging. But when your brain's blood flow is even slightly interrupted, the effects may show up fast, and missing those signals may be life-altering. In this video, we'll walk you through 10 warning signs you are going to have a stroke soon. Each symptom reveals how different parts of your brain and body are crying out for help and why quick action matters. And if you notice any of these signs, don't wait. Consult a healthcare provider immediately. Now, let's get started. 1. Sudden trouble speaking or understanding speech. Imagine you're in the middle of a conversation and suddenly your words feel scrambled, or someone asks you something simple and you can't make sense of it. This isn't just being tired or distracted. This could be your brain signaling a stroke is on the way. When a stroke disrupts blood flow to the brain's language centers, mainly Broca's area and Wernicke's area, the neurons that control speech and understanding start losing oxygen. These areas are located in the left hemisphere and are highly sensitive to reduced blood supply. Without proper oxygen, the signals between your brain and mouth don't connect correctly, causing slurred speech, jumbled words, or trouble forming sentences. It may happen in seconds. You might still be fully awake and aware, but unable to express your thoughts. Or you might hear words but not grasp their meaning. This is a serious neurological alert, not something that will just pass. A PubMed study of 936 stroke patients found that 82% had speech issues at admission, mostly dysarthria, affecting muscle control for speech, and aphasia, which impairs understanding or expression. These patients also showed a significantly higher risk of death. 2. Facial drooping or asymmetry. You look in the mirror, or someone points it out, and one side of your face seems to droop. Maybe your smile looks uneven, or your eye on one side won't close completely. This isn't just fatigue or a minor muscle spasm. It's a potential red flag that your brain is losing control over facial movement, and a stroke could be the cause. When a stroke affects the part of the brain that controls facial muscles, it often disrupts the facial nerve pathways, especially those running through the brainstem or motor cortex. These nerves coordinate the small, complex movements that allow you to blink, smile, frown, or raise your eyebrows. Without proper blood flow, the nerve signals don't reach the muscles on one side of the face, leading to weakness or complete paralysis in that area. The change may be sudden and is usually painless, which makes it even more dangerous. According to Frontiers in Neurology, central facial paresis, often seen as facial drooping, is a common early stroke sign. A study found that 60% of first-time ischemic stroke patients showed this symptom, while other studies report a prevalence of about 45%. 3. Sudden numbness or weakness on one side of the body. Out of nowhere, your arm feels heavy, your leg won't move right, or your fingers go numb, all on just one side of your body. This kind of sudden weakness or loss of feeling isn't just a pinched nerve or poor posture. It's your brain sending out a serious distress signal that something is blocking its control over movement and sensation. Your brain controls each side of your body through opposite hemispheres. So when a stroke hits the right side of the brain, it may affect the left side of the body and vice versa. The issue begins when a blood clot or bleed cuts off circulation to the motor cortex or somatosensory regions, which are responsible for muscle strength and touch. Without oxygen, these brain cells stop functioning properly, and your muscles no longer respond the way they should. In a PubMed study of 26,800 individuals, researchers found that participants with darker skin tones were significantly more likely to report unilateral numbness, a common stroke symptom, than those with lighter skin, revealing a notable racial disparity in symptom presentation. 4. Loss of vision in one or both eyes. Everything goes blurry. A dark shadow moves across your vision, or it suddenly feels like someone turned off the lights in one eye. These aren't typical vision problems. Sudden loss of sight in one or both eyes could be an early sign that your brain's visual system is under attack from a stroke. Your eyes may be working fine, but your brain is what actually processes what you see. The occipital lobe, located at the back of your brain, interprets signals from the optic nerves. When a stroke blocks blood flow to this area, or to the optic pathways, the brain may no longer process images clearly or at all. In some cases, the stroke may affect only one side of the brain, causing vision loss in the opposite visual field of both eyes, a condition known as homonymous hemianopia. In a PubMed study of 10 stroke patients, 7 developed hemianopia, losing vision in half of their visual field. 2 also showed neglect, ignoring the affected side. 1 experienced double vision, and another had vision loss in one eye, making hemianopia the most common visual deficit after stroke. 5. Sudden dizziness or loss of balance. You're walking across the room, and suddenly the floor feels like it's shifting beneath you, or the world starts spinning, even though you're standing still. That kind of sudden dizziness or loss of balance isn't just dehydration or low blood sugar. It could be your brain warning you of a stroke in progress. Your sense of balance is controlled by a network involving the cerebellum, inner ear structures, and brainstem. When a stroke disrupts blood flow in the areas responsible for coordinating movement and spatial awareness, those systems stop working smoothly. As a result, you may feel off balance, stagger when walking, or find it hard to coordinate simple movements. Posterior circulation strokes, those affecting the back of the brain, are often the culprits behind these balance symptoms. They may make you feel like you're tipping over or struggling to stay upright, even while seated. A study published in Neurology Research International involving 140 patients with recurrent stroke or transient ischemic attacks found that only 21% recognized sudden trouble walking, loss of balance, or dizziness as stroke warning signs. 6. Unexplained severe headache. It strikes like lightning, an intense, unbearable headache that comes out of nowhere. This isn't your usual migraine or tension headache. A sudden, severe headache with no clear cause may be one of the most alarming signs that a stroke, especially a hemorrhagic one, is happening. This type of headache occurs when a blood vessel in the brain bursts, leading to bleeding in the surrounding tissue. That bleeding increases pressure inside the skull almost instantly, irritating sensitive brain membranes and triggering extreme pain. The subarachnoid space, which cushions the brain, is particularly vulnerable to this pressure, and when blood enters it, the result may be a sharp thunderclap-like headache. Some people describe it as the worst headache they've ever felt. Don't wait to see if it passes. When the pain hits that hard and fast without warning, it could be the brain's final alert before permanent damage begins. In a study, researchers analyzed 263 stroke patients with an average age of 76 and found that around 19% experienced new-onset headaches. While not definitive, severe headaches showed a slight tendency to be linked with vertebrobasilar ischemia. 7. Transient loss of consciousness or confusion. One moment you're alert, and the next everything feels foggy, or you completely black out for a few seconds. That kind of sudden confusion or brief loss of consciousness isn't just fatigue or a skipped meal. It may be an early and dangerous sign that your brain isn't getting enough oxygen because of a stroke. When blood flow to the brain drops sharply, especially to areas like the reticular activating system or frontal lobes, it may interrupt your ability to stay conscious and think clearly. These regions manage awareness, attention, and memory. Without proper circulation, your brain struggles to process information, leading to disorientation, mental blanking, or even brief unconsciousness. Some people may appear dazed, forget where they are, or start speaking in a way that doesn't make sense. If you or someone else suddenly seems mentally off or passes out without warning, don't ignore it. It may be the brain's early cry for help before more severe symptoms strike. In a PubMed study of 1,200 stroke patients, women were more likely to present with non-traditional symptoms like altered consciousness and disorientation, highlighting gender differences in stroke presentation. 8. Sudden difficulty walking or coordinating movements. You're trying to take a step but your foot won't follow through or your arms won't move in sync, making even simple motions feel clumsy and off. When walking becomes unstable or your movements feel disconnected from your intent, it could be a sign that your brain's coordination centers are under stress from a stroke. This symptom often begins when blood flow to the cerebellum, the part of the brain that controls balance and motor coordination, becomes restricted. Without enough oxygen and nutrients, the cerebellum struggles to manage smooth, controlled movements. That disruption causes your body to lose its rhythm, leading to stumbling, dragging feet, or even collapsing without warning. In some cases, the stroke may affect deeper pathways like the basal ganglia, or connections between the brain and spinal cord, making movements feel shaky, delayed, or imprecise. If walking or coordination changes without explanation, it's not just clumsiness, it's your nervous system signaling trouble. A study in the Journal of Rehabilitation Medicine, involving around 1,100 stroke patients in Sweden, found that both physically active and inactive individuals showed significant improvements in mobility, walking, and upper limb function during hospitalization. However, those who were active before the stroke showed a slight trend toward faster recovery. 9. Drop-in alertness or sudden fatigue. You're wide awake one moment and then suddenly your energy crashes, you can't stay alert and everything feels heavier than usual. This kind of intense, unexplained fatigue or drop-in alertness isn't about needing more coffee. It could be an early neurological sign that your brain is under threat from a stroke. A stroke may interfere with blood flow to the frontal cortex and thalamus, regions that help regulate wakefulness, focus, and drive. When oxygen delivery to these parts is reduced, your brain shifts into a low-power state, making you feel drowsy, foggy, or disconnected from your surroundings. It's not just tiredness, it's your brain working with limited fuel. This sudden fatigue may also happen when the body tries to conserve energy due to rising intracranial pressure or expanding brain injury. If someone who's normally alert suddenly becomes unusually sleepy or disengaged without a clear reason, don't assume it's harmless. It could be a quiet but serious warning that a stroke is already starting. In a PubMed study of 115 first-time stroke patients, 30% reported fatigue before the stroke, while 24% experienced severe fatigue afterward, affecting women more frequently than men. 10. Hiccups with chest pain or shortness of breath. You get a strange case of hiccups that won't stop, and it's paired with tightness in your chest or difficulty breathing. For women especially, these unusual symptoms may be early signs of a stroke, not just digestive issues or anxiety. These signs happen when a stroke affects the brainstem, which controls basic body functions like breathing, heartbeat, and reflexes, including hiccups. When the blood supply to this area is disrupted, the signals that regulate your diaphragm and chest muscles become erratic. That may lead to persistent hiccups, a feeling of chest discomfort, or shortness of breath that seems to come out of nowhere. The stroke may also involve nearby regions responsible for autonomic function, which explains why these symptoms may mimic heart or respiratory conditions. If these sensations hit suddenly, especially along with confusion or imbalance, don't brush them off. These subtle but serious signs may be the body's early warning that a stroke is developing beneath the surface. According to PubMed, acute hiccups typically last from a few minutes to several hours. Persistent hiccups continue for over 48 hours, while intractable hiccups are those that last longer than 1 month. 6. Daily habits to protect you from stroke. When it comes to stroke, prevention starts with your daily choices. We often overlook simple habits that have powerful effects on brain and heart health. But with just a few consistent changes, you may lower your risk and stay one step ahead. 1. Start your day with 30 minutes of physical activity. Daily movement helps keep your blood vessels healthy and your blood pressure in check. Physical activity improves circulation, strengthens the heart and prevents blood clots, one of the leading causes of ischemic stroke. Regular exercise also improves the flexibility of arteries and reduces inflammation, which supports smoother blood flow to the brain. Walking, cycling, swimming, or even light yoga may enhance vascular function and stabilize cholesterol levels. 2. Maintain a balanced blood pressure through diet. Keeping your blood pressure in a healthy range is one of the most powerful stroke prevention tools. High blood pressure weakens artery walls and increases the chance of rupture or blockage in the brain. You may help regulate it by limiting salt, processed foods, and saturated fats. Focus instead on potassium-rich foods like spinach, sweet potatoes, lentils, and bananas. These help balance fluid retention and ease pressure on blood vessels. 3. Stay hydrated throughout the day. Proper hydration keeps your blood viscosity low, reducing the chance of clots forming and blocking a brain artery. When you're dehydrated, blood becomes thicker, making it harder to circulate efficiently, especially to the brain. Water also helps regulate body temperature, supports kidney function, and improves nutrient transport, all of which indirectly reduce stroke risk. Even mild dehydration may lead to dizziness and low blood pressure, potentially triggering fainting or poor oxygen delivery to the brain. Experts recommend at least 6 to 8 glasses of water daily, but your needs may be higher in hot weather or during physical activity. By making hydration a non-negotiable part of your day, starting with a glass of water first thing in the morning, you support better circulation and reduce the strain on your cardiovascular system. 4. Limit added sugar and ultra-processed foods. Excess sugar and highly processed foods contribute to insulin resistance, obesity, and inflammation, all risk factors for stroke. Over time, they increase triglyceride levels and contribute to the buildup of plaque in your arteries. High blood sugar levels damage the inner lining of blood vessels, making them more vulnerable to blockages or ruptures. Processed foods often lack fiber and essential nutrients, which means you're eating calories with little benefit to vascular health. By cutting back on sugary drinks, pastries, processed meats, and salty snacks, you reduce systemic inflammation and help your body maintain stable insulin and cholesterol levels. 5. Get at least 7 to 8 hours of quality sleep. Your brain and blood vessels repair and reset during sleep. Skimping on rest increases cortisol levels, elevates blood pressure, and disrupts your body's natural rhythm, all of which stress your cardiovascular system. Chronic sleep deprivation also impairs glucose regulation and increases the risk of atrial fibrillation, a heart condition strongly associated with stroke. Fragmented or short sleep reduces the body's ability to manage inflammation and recover from daily stressors. Establishing a regular bedtime, limiting screen time before bed, and creating a dark, quiet environment may improve both the length and quality of your sleep. 6. Practice 10 minutes of daily stress reduction. Chronic stress triggers a cascade of harmful effects, raising blood pressure, thickening blood, increasing heart rate, and impairing sleep, all of which burden the brain's delicate vascular network. Simple practices like deep breathing, guided meditation, gratitude journaling, or walking in nature help calm your nervous system and reduce inflammatory stress hormones like cortisol. These techniques restore balance and support better blood pressure control. Individuals who adopt regular mindfulness or relaxation practices show measurable improvements in heart rate variability and vascular tone. Even 10 minutes a day may create a protective buffer for your brain, improving resilience and reducing your risk over time. Many of these symptoms may seem benign or resemble other conditions, but in the context of stroke risk, especially for individuals with high blood pressure, diabetes, or atrial fibrillation, they demand immediate attention. Acting within the first hours may make the difference between full recovery and permanent disability. If any of these signs emerge suddenly, call emergency services immediately. Today, we learned about all the warning signs that you may experience before a stroke. But, did you know that there are other signs that your health might be at risk? Do you want to find out more? Well, you should watch Don't Ignore These 8 Nighttime Signs of Diabetes. Or watch 13 Warning Signs of Vitamin B12 Deficiency. You may watch either or both of them. Do you know any other signs of stroke that were not mentioned earlier? Let us know in the comments section below.